Okay, so the situation is this is Mr. Rodney Davis. He's a 54-year-old male. He came in with a chief complaint of chest pain that started at home while he was shoveling his driveway. He said he tried to sit down a few times to see if rest would help with it. It did not. So then he took nitroglycerin times 3, and that also did not help with it. So he decided to call 911, and they brought him in here to the ER. Like I said, as for background, he's a 54-year-old male. He has a history of hypertension, coronary artery disease with angina, and asthma. As for assessment, we took his vital signs, and the temperature was 99.0 degrees Fahrenheit, heart rate at 106, blood pressure at 100 over 66, respiratory rate of 24, O2 was at 96% on 4 liters nasal cannula, and the glucose was at 118. We also assessed his pain because that's what he came in with was the chest pain. The onset, he said, had been around 4:55, and he got there around 5:30ish, so about half an hour. The location was in his chest, but it was mainly over his heart. Duration had been constant since it started. Characteristics, he said it was like a squeezing type of pain. Aggravating factors was activity or straining, like shoveling his driveway made it worse. Relieving factors, he hadn't found any as of yet. He had for treatment, he had tried rest, nitroglycerin, and I believe it said that his wife had given him some aspirin at home, and that none of that helped. And severity, he rated it at an 8 out of 10. As for my recommendations, I recommend we do some blood draws, see a troponin level, maybe a CMP, BNP. I would also suggest possibly a chest X-ray, maybe, to try to get him into the percutaneous coronary intervention cath lab type thing. I'd also would like to see an EKG to see if maybe it's a systemi, or if it's an NSTEMI, or if there's maybe something else going on. I'm not sure. But yeah, those are my recommendations.